This explainer is based on Understanding and Recovery Vestibular Neuritis, published by the Australian Dizziness Clinics. So if you, or maybe someone you care about, has just been diagnosed with this condition, you're probably feeling overwhelmed, completely off balance, and honestly, pretty scared. Today, we're going to walk through these clinical resources together so you can understand exactly what's happening inside your inner ear, what recovery actually looks like, and how your brain is already starting to heal itself. So let's dive right in. First things first, take a deep breath. The sudden onset of severe, relentless spinning and nausea is absolutely terrifying. I mean, it is incredibly common for patients to rush straight to the emergency room, totally convinced they're having a stroke or maybe a brain tumor. But as the clinical guidance stresses here, your brain adapts remarkably well. You are safe, and this is not a stroke. It is definitely not life-threatening. What's happening is your body is going through an intensely powerful sensory illusion. We're going to look at exactly why this illusion happens, and more importantly, how your body is already working to overcome it.
So you might be wondering, if it's not a stroke, what on earth is it? Well, vestibular just refers to your balance system, and neuritis simply means nerve inflammation. Put those together, and you get the sudden inflammation of one of your balance nerves. And surprisingly enough, in the vast majority of cases, this is actually caused by a common, otherwise harmless virus, often something from the cold sore virus family. When this virus reactivates, the nerve gets inflamed and basically acts like a blocked wire, which temporarily stops sending its normal steady stream of balance signals to your brain. So really, it's just a temporary mechanical failure. It's not some permanent degenerative disease.
To make sense of this, think of your balance system like a twin-engine airplane. You've got one balance nerve in your left ear and another in your right ear. Now, when you're healthy, both nerves send equal, steady signals to your brain. It's like two engines running at the exact same speed, keeping the plane flying perfectly straight. But in vestibular neuritis, one of those engines suddenly drops out. The inflamed ear goes totally quiet, while the healthy ear keeps firing away at full speed. So your brain gets this massive mismatch in signals and interprets it as this rapid, chaotic spin toward your healthy side. The room around you isn't actually spinning, of course, but because of this signal mismatch, your brain is absolutely convinced that you are.
If we look a little closer at the anatomy of that blocked wire, you'll see a red, inflamed area on the superior branch of your vestibular nerve. That's our engine that dropped out. But notice the nerve sitting right just below it, the cochlear nerve. That is your hearing nerve, and it remains completely untouched. In classic vestibular neuritis, your hearing nerve is totally separate and perfectly safe. So you might feel incredibly dizzy and nauseous right now, but your hearing itself should be completely normal. This structural separation is exactly why your symptoms are so specifically targeted at your balance, and nothing else.
Just knowing what to expect next can really take away a lot of that fear of the unknown. Your recovery is generally going to follow 3 distinct progressing phases. First up is the acute phase, roughly days 1 to 3. This is without a doubt the hardest part. You're dealing with severe spinning and nausea, and during this time, bed rest is absolutely necessary. And honestly, it's completely okay to just lay low. But then as you move into days 4 through 14, you enter the compensation phase. The spontaneous spinning while you're resting will stop, and you'll only really feel dizzy when you move your head. This is actually a great sign. It means your brain is actively recalibrating to its new normal. Finally, you move into the recovery phase. This spans weeks to months, where your brain fully rewires itself, and you gradually just get back to your completely normal life.
So how do we actually help that recovery process along? Well, we can build a path back to health through a clear treatment staircase. And the good news is, you actually have a lot of control here. Step 1 is pretty straightforward. During those first 24 to 48 hours, just rest until the acute vomiting settles down. Seriously, do not push yourself here. Step 2, if your doctor prescribed them, make sure to take your short-course steroids. Clinical evidence shows that taking steroids within the first 3 days really helps rapidly reduce the swelling on that affected nerve. And then there's step 3. Once that acute phase passes, you'll want to start vestibular rehabilitation therapy, ideally with a trained physiotherapist. This therapy is quite literally the single most evidence-based way to actively speed up your brain's healing process.
And that leads us to the absolute golden rule of your recovery. Movement is your medicine. Now, in the emergency room, you were probably given some vestibular suppressants to stop that initial spinning. And hey, those are super helpful early on. But you really must stop taking them after 3 days. Why? Because they literally suppress your brain's ability to adapt. For your brain to heal, it actually needs to feel the air. It needs to feel a little bit dizzy. By pushing through that mild discomfort and doing gentle, targeted head movements, you are actively forcing your brain to route around that blocked wire and rebalance the whole system.
Now, while we know the normal course of this condition is highly reassuring, having a clear safety net is just essential. So there are a few very specific red flags that mean you need to seek urgent medical care immediately. If at any point you develop double vision, slurred speech, difficulty swallowing, sudden hearing loss in one ear, or if you find you have an absolute inability to stand up, even when someone is physically supporting you, you need to go back to the hospital. These are atypical symptoms, and they suggest that something other than just a simple inflamed nerve might be going on, which means they require a doctor's immediate attention.
But remember, for the vast majority of people, vestibular neuritis is just a temporary hurdle simply because your brain is incredibly resilient. I highly recommend you visit AustralianDizzinessClinics.com to download this patient information sheet, and please bring any lingering questions you have to your next appointment. Subscribe to support our work and help other patients find us. As we wrap up today, I want to leave you with a pretty amazing thought. If our brains are plastic enough to literally rewire themselves around a disconnected nerve in just a matter of weeks, what other incredible acts of healing are we truly capable of?